Thank you for your interest in the Rural Health Clinic program. You've accessed part 1 of the 5-part session entitled Rural Health Clinic 101. The Rural Health Clinic 101 session is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the Rural Health Clinic program, please access parts 2 through 5 of Rural Health Clinic 101, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health. What is a Rural Health Clinic? Rural Health Clinic certification is a designation from the Centers for Medicare and Medicaid Services, or CMS, to clinics providing primary care in certain rural, underserved areas, and it provides an alternative cost-based reimbursement system for treating Medicare and Medicaid beneficiaries. The Rural Health Clinic program is targeted for expanding services to Medicare and Medicaid beneficiaries, and it's generally not recognized by commercial insurance carriers or other non-governmental payers. This is a targeted program for governmental programs for Medicare and Medicaid beneficiaries. The Rural Health Clinic program has been in existence for over 40 years, and its original purpose was for expanding access to primary care services in these rural and underserved areas. Unfortunately, access to primary care services is still limited in many rural markets, and the Rural Health Clinic program continues to help support these services when necessary. The program started from relatively humble beginnings. Less than 500 rural health clinics were certified as rural health clinics during the first 10 years of the program's existence. Today, over 4,300 clinics are certified as rural health clinics across the country. In terms of the number of rural health clinics by state, the largest number of rural health clinics are currently located in the state of Missouri. The Missouri rural health clinics grew from only 2 rural health clinics in 1989 to 370 clinics today in the state of Missouri. Currently in Wisconsin, there are 80 clinics certified as rural health clinics. The Wisconsin Rural Health Clinics has increased over 30% in the last 5 years. Rural health clinics are located in nearly every state of the United States. Currently, only 6 states, Alaska, Connecticut, Delaware, Maryland, New Jersey, and Rhode Island, do not have rural health clinics. As you can see on this map, a concentration of rural health clinics are located in the breadbasket of the United States throughout the entire Midwest. The basic elements for rural health clinic eligibility and the primary benefit is contained in our definition of a rural health clinic. There are 3 primary elements that allow a clinic to be designated as a certified rural health clinic. Those 3 elements include the provision of primary care services, the location of the clinic in a rural area, as well as the location of the clinic in a designated underserved area. The primary benefit from a financial perspective of the Rural Health Clinic program is the replacement of the current and existing fee-for-service reimbursement structure within both Medicare and Medicaid with a cost-based reimbursement structure for services provided to Medicare and Medicaid beneficiaries. The first element of eligibility for a clinic in the Rural Health Clinic program is the provision of primary care services. And under the Rural Health Clinic program, primary care services are defined as the treatment of acute or chronic medical problems which bring a patient to a physician's office. Under the Rural Health Clinic program, a clinic must be primarily engaged in providing primary care services. So essentially, a majority of the services provided by that rural health clinic must be considered primary care services based on the definition in the program. That doesn't mean that a rural health clinic cannot provide non-primary care services. In fact, many rural health clinics provide minor surgical procedures and diagnostic services, which may not be considered within the scope of primary care services. However, in order to become certified, a rural health clinic must demonstrate that it's primarily engaged in providing primary care services based on its total hours of operation. So if during the total hours of operation, an existing clinic is providing primary care services greater than 50% of the time, that clinic will be considered primarily providing primary care services and eligible for rural health clinic designation. Another basic element of primary care rural health clinic is its location. And the location of that clinic must be considered rural according to the US Census. Essentially, rural is the opposite of urban. So if an area is not considered urban, by definition, therefore, it is considered rural. Any prospective clinic that wants to become a certified rural health clinic would need to verify that its current location is considered rural. And there are a number of sources that can be used for verifying the location of that clinic as rural. US Census Bureau is one source. We've identified on our slide the use of a tool on the Rural Health Information Hub called Am I Rural? And this tool allows an individual to input an exact location and look up its rural status. The third primary element that needs to be concerned with in determining the eligibility for a clinic to become a certified rural health clinic is what's called the designated underserved area status. There are a number of different designations that can meet the definition of underserved for qualification as a certified rural health clinic. The first designation is a governor-designated shortage area. This allows for a designation that is state-specific and is applied in only those states that have developed the criteria for identifying a shortage area as a governor-designated shortage area. Any governor-designated shortage area can be used for qualifying a clinic as a certified rural health clinic. Not every state, however, has a governor-designated shortage area criteria, and not every state designates areas as shortage areas. For those states who do not offer this opportunity, federal designations such as the Geographic Medically Underserved Area, or MUA, the Geographic Health Professional Shortage Area, or HPSA, or the Population-Based Health Professional Shortage Area can be used in determining the eligibility of a particular area for the Certified Rural Health Clinic program. Again, there are multiple resources that can be used to research the current shortage area status. We typically use the Rural Health Information Hub as a primary resource for identifying the eligible shortage area status for any given location. And finally, the primary benefit of a rural health clinic designation rests with the reimbursement. And reimbursement is for rural health clinic determined based on cost on an average cost per visit basis. A visit for rural health clinic purposes is defined as a medically necessary face-to-face encounter between a physician, nurse practitioner, physician assistant, certified nurse midwife, clinical psychologist, or clinical social worker, and a Medicare or Medicaid patient. If a medically necessary face-to-face encounter does not occur between the patient and a rural health clinic practitioner, no billable encounter or reimbursable visit has occurred. For comparison purposes, we've illustrated Medicare payment rates for various services. The first bar, the green bar, shows the Medicare Part B physician fee schedule for a typical established patient office visit with CPT code 99213. In the state of Wisconsin, that Medicare physician fee schedule payment in 2018 was just under $71 for a level 3 established patient office visit. A level 4 established patient office visit in Wisconsin in 2018 is just under $105. And that's illustrated in the blue bar on our graph. The light blue bar illustrates the national independent rural health clinic payment limitation of $83.45. That amount, as shown, is between the fee-for-service reimbursement for a level 3 visit and a fee-for-service reimbursement rate for a level 4 visit. The last bar, shown in red, illustrates the national average rural health clinic reimbursement rate for provider-based rural health clinics, those that are affiliated with hospitals. And that rate in 2017 on a national average was approximately $193 per visit. So as you can see, there can be a significant difference in reimbursement between an independent rural health clinic and the Medicare physician fee schedule for a typical office visit, as well as the Medicare reimbursement rate for a provider-based rural health clinic based on 2017 national data. This concludes part 1 of the Rural Health Clinic 101 session. Thank you again for your interest in the Rural Health Clinic program. For additional information about the Rural Health Clinic program, please access parts 2 through 5 of Rural Health Clinic 101, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health.